are correct, but we'll we'll go through it just to reinforce those things. The other thing I did for you is that in previous years, the competency wouldn't be scheduled until April, so you'd have these reviews in January, and then for most of you, unless you came onto block, it wasn't fresh in your mind. So luckily, I was able to move it forward earlier. It's early early March. So hopefully, some of the stuff it'll seem familiar. You'll review right before and do well in the competency. The last thing I want to say is that you get 3 chances. Now, if you pass on the first, unless you're a borderline grade person, I'd say just stop at that, because what happens is that it's your last attempt that counts. So if that makes sense, it's like, say you get an 85 the first time, and you say, oh, let me do better. And the next time you get an 8, and you're like, oh gosh, I passed, but I don't want to, take it again. Your grade for that competency would be an 80, not an 85. So it's the last one. So unless you're borderline, that's my suggestion for you. Once you pass, move on with your life, and you'll keep the same grade. Now, if you are borderline and you think that you can get a higher grade, go for it. But just keep in mind it's your last grade or your last attempt that counts. All right, any questions, just put them up in the chat. I'll keep an eye out for that. So let's get started. You are reviewing the dental history for your 12-year-old patient in the PEDS clinic. The dental history should include. So remember, these are going to be very direct questions for you. And pay attention, it's dental history, not medical history, not caries risk assessment, not behavior assessment, not, whatever. What is involved in a dental history? So we look at it, patient's dental home, if any, yes. Any previous dental treatment completed? Absolutely. Allergy, if any. Now, most people would think, oh, I'm seeing a new patient. Of course, I'm going to check for allergies. That belongs in the medical, right? Patient's experience during dental visit? Yes, we want to know that. And the last one, socioeconomic status. That's going to actually fall under caries risk assessment. So the answer should be A, B, and D, right? So pay attention that we're asking for dental, not caries risk or medical. All right, I'm assuming everyone got a screenshot, or one of you did, and you're restricted, whatever you guys need to do. All right, you're about to apply fluoride varnish for a 6-year-old patient with moderate caries risk. Remember, know those tables. That's what's going to help you review for this. Which of the following statements are correct? Apply enough varnish so you can see it. Great. I agree. Use the wipe and painting. Yep. Wipe the teeth with gauze. Paint on the fluoride varnish. Dry all the tooth surfaces. I should put a comment, but if you can. It's not 100% important that it's completely dry, because, right, we want that pellicle to absorb the fluoride on there. But yeah, you want to dry it if you can. And then advise patients to avoid hot drinks after. Absolutely. You don't want to take hot drinks, crunchy stuff that's going to get stuck in a waxy fluoride varnish. So all the answers are correct. Okay. And just a reminder, your competency will be 4 multiple choice, 1 correct answer. You are providing counseling and assessment for treating a developing malocclusion. So if you remember, so these things are being pulled right from the guidelines. You've already studied this in the fall. Hopefully, again, this is supposed to be a review. So you kind of lock in it. Hopefully some of it locked into your long-term memory. And then when you see it, you're like, oh yeah, I know this. That's the approach I hope you get to take with this. So anticipatory guidance, malocclusion, we're talking about like non-nutritive sucking habits, those types of things. So 1-year-old up until 1 year old, totally normal. For any of those who you have young kids or, your kids were younger at one point, know that thumb sucking, bottle drinking, nursing, that's all normal up to the age of 1, and sometimes even a little bit after. 2, you can start to see signs of a malocclusion with non-nutritive sucking habits, right? So 2 seems like appropriate. 8 and 12, it's a little too late to begin providing counseling. So 2 would be the answer. Now in the guidelines, you'll see that it's actually 3 years old where at that point you have to, but this one, it says should. It's not a great question, but know that it's the earlier time. Up to 1 is okay. 2 to 3 is when you start counting, but 3 is definitely when you need to. All right, what daily dosage? This is memorizing the fluoride supplementation. 2-year-old living with fluoride level at 0.4. So that's not optimal, but there is some fluoride in the level. 2-year-old, so that's going to be 0. Excellent. Just memorize the chart, or memorize it 5 minutes before you take the competency. I haven't cared if you guys write down on scrap paper. Obviously, I don't want you checking cell phones and stuff during the exam, but if you memorize it 5 minutes before, write it down. That's cool with me. All right. Next question. You are doing the anticipatory guidance counseling. So again, that same guideline with Anticipatory young scaling, 3-year-old new patient. What should you include? Injury prevention, absolutely. At all ages, you're going to do injury prevention, especially at a 3-year-old. Substance abuse, we do have a patient population that I think there is exposure to substance abuse or the risk for it at an earlier age than we might expect, but a 3-year-old is way too young. So that's fine. That's not going to be an answer. That would be appropriate for a 3-year-old. Oral hygiene diet, that's standard. And then non-nutritive sucking habits, that's exactly what we talked about. Bottle at night, pacifier, thumb sucking, finger sucking, that sort of stuff. So that's going to be A, C, D, E are all going to be, potential correct answers. All right, you're doing caries risk assessment. Again, memorize that chart. 10-year-old recall patient. The factors you should include, right? So what's on a caries risk? Just look at it. You'll see the different things on the side. There's biological, there's clinical, there's all these different things. So previous caries experience, absolutely. If there's been previous caries, that's going to affect your caries risk. The dietary habits, yes, right? If you're having sugar-sweetened beverages, if you're having high sugar exposures, patient's previous dental experience. Okay, remember that's dental history, not caries risk. Socioeconomic status, I said that's on there, right? If you grow up in generational poverty, if you have low health literacy, those are in the newer guidelines. Socioeconomic status is going to affect it. And of course, the patient's oral hygiene, if clinical factors, if you have plaque all over the teeth, that will increase your caries risk. So the answers will be A, B, D, and E. All right, take your screenshot, or one person do it, whatever. All right, cool. Which of the following items should be reviewed in order to determine the prevention strategy for your 5-year-old new patient? Again, remember caries risk, right? It's under 6 years old, and then there's a 6 and over. So there's going to be different things. If you remember this is prevention stuff that we talked about in your case seminars, your written case assignment. So again, nothing new. You've done it. Hopefully some of it's in your long-term memory. Fluoride exposure, absolutely, right? Diet and snack habits, absolutely. Caries risk, absolutely. Low versus high, and then oral hygiene and home care. So the answer would be all of them. But you've already done this. You've already written a paper on this, and you've already talked about it in seminar. So again, all review. Remember what I said in previous semester, if you remember it all. Best way to study for things, for exams, is to create your own test questions for study or practice test questions. So that's exactly what I want you to do for competency. And review the charts, of course, and guidelines. Okay, clinical exam, new 2-year-old patient, white spot lesions, E and F. How would you recommend topical fluoride treatment for this patient? How often? Now remember, this is a caries risk and then periodicity. So like I said, I will keep repeating it. Under 6 years old has different caries risk things. It's more actually, and then you have the older. Well, it depends because the older one has some certain categories in the biological, but and then older than 6. So under 6, any signs of any carious lesions is going to put you in high, whether those be white spot lesions, actual cavitated decay. Under 6, that's high. When you get over 6, it may only be moderate, right? If you haven't seen decay. So under 6, 2-year-olds under 6 is definitely high. So periodicity for high caries risk is every 3 months. All right, so and now you're doing the clinical exam for your 8-year-old new patient in the PEDS clinic. So 8 years old, right? So just hear the age. Now you're already thinking caries risk chart is going to be from above 6. Periodicity is going to be a little different. Now we're middle mixed dentition. Remember, early there's under 6 should be all primary. Then 6 to 12 is your mixed dentition. Early mixed is 6 to 8, where you're expecting the incisors and first permanent molars to come in during that time. 8 to 10, nothing's happening for the average kid. Then 10 to 12, that's your late mix, right? So that's your molars and your canines exfoliating, and the premolars and canines coming through. And then after 13 and older should be all permanent for the average kid. Anyway, when you do a occlusal assessment, this is exactly the 4 things you're going to check for. Crowding or spacing, molar canine relationship, class 1, class 2, class 3, open bite, cross bites, or an overgent overbite to see if anything severe. The whole point of this is, do we do phase 1 orthodontics, interceptive, that sort of stuff. All right, so remember I said this is not case-based, but you might get some information about a kid. So 8-year-old new patient, like I said, look at that. Average mixed, it's a middle mixed dentition. Looks like the first permanent molars have come through. we don't, it looks like not all the lateral incisor hasn't come through yet, but about on average. You were able to obtain 2 bite wings. She was very nervous. Clinical exam, you noted a lot of decay and premature tooth loss. You think she's high caries risk, which would be correct, and your global treatment plan should include. Again, this is just like we did for the case seminars, reading case assignment. You did this, so hopefully in long-term memory. So SSCs on BNI. So if you look at BNI, you should be able to see my thing here. Look at this. Resorption here, a little bit of intrafocal radiolucency, same here. Deep caries, more than 2/3 of the tooth will be gone, same here. This is totally non-restorable. So doing crowns on these would not be indicated. Either extracting would be indicated, right? There's not enough tooth left. Nervous kid, nitrous oxide, great. Let's do it. Lower arch, right? We've got this 2 open spaces, so we definitely want to maintain or possibly regain that space for the lower arch. Because it's only age. She won't be, these premolars likely won't be coming in for another 3 years. So definitely want to consider that. And then high caries risk, that same thing, going back to periodicity, 3-month recall, fluoride varnish. All right. So I'm going to bring up radiology. This is the longer one. Let's going to be shared with everyone. Go share this guy. All right, so radiology. Now this is going to be a little bit different. You are going to get some images. There's going to be some basic radiology techniques. Hopefully Dr. Price has, and his department has solidified that in long-term memory as well. Like for instance, like angle of taking an occlusal or, a bite move, that sort of stuff. Hopefully those are gimmies. Those are the kind of just like memorize, regurgitate, get the points. The other ones will be interpreting the radiographs, but again, it comes back to radiograph periodicity, knowing how old the kid is, what caries risk they're at, and evaluating. So let's start with this. You're gonna get some PANs, and here's a 9-year-old, right? So I'm gonna just review with you on how to read a PAN, and this also comes from my own practical experience. Is that when you're busier, right? I know you got the 2 hours for your patients, but when you're busier and you have to see a recall every 15 to 30 minutes, or you're doing your op and then you get pulled for a recall, whatever it might be. The idea is that if you have a systematic approach, and I'm sure radiology does this to you, but I've just learned this myself because there's nothing more embarrassing like when I missed an abscess in my first few months of raging abscess on a kid in my first few months of residency, or you miss a pathology, it's like, how did I not see that? So take the same systematic approach, because when you're looking at bite wings, I guarantee you're going to figure out where the caries are, but you may miss a pulp issue or a bone issue. PAs, I'm sure you're looking at the periapical area, but you might miss something intrafocally or something. And same thing with PANs. You might be like, oh, there's a missing tooth, but then there's a major pathology up in the sinus. So I say the outside-in approach is the best, right? Always do the thing that you know you'll do best, right? So bite wings, look for caries last. PANs, look for missing teeth last, right? So overall for kids, what I'm going to recommend is start with the TMJ. And usually, unless there's been a certain sort of trauma, TMJ is almost always normal because they're growing so much. It's remodeling, it's accommodating. Typically, there aren't TMJ issues. So the TMJs are normal. Now, that outside-in approach, what I was talking about is look in the sinuses. Great, nothing. The mandible, no major pathology. Great. The maxilla, no major pathology. Awesome. So now let's go inside to the next part. All right, let's look at succedaneous teeth, right? 9-year-old, we're expecting middle mixed dentition, still going to be getting some teeth. So if we look through, let's start here. We see 1, 2, 3, 4. Is that 5? Yeah, it's 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, right? So looking at the succedaneous area, also not seeing any pathology, good. Then we have 17 through 32, right? You can look across and see that they're coming through. So great, no congenitally missing teeth, awesome. The next one is for the erupted, right? So now we're looking, is this kid an average, are they of the dental age that would be appropriate for them? So middle mix, we're expecting all 8 incisors, which are in. First permanent molars, well, this guy's super decayed, but yeah, that was in. And then it looks like it's starting to exfoliate the premolar, the molars and canines too. So a little bit ahead, but on average dental development, right? So normal TMJ, great. Average dental, great. No congenitally missing teeth, so I don't agree with that. Severe decay on 30, yep. Impaction third molars, doesn't look like it. And abnormal root resorption number J. So if you look, there is root resorption on J, but that's normal, right? Because you have a succedaneous tooth. You have number 13 coming up and resorping the roots. Totally normal. So the answer should be A, B, and D. Great. All right, so 12-year-old new patient. Now we have a kid that should be at the end of late mixed or beginning of all permanent, right? You ordered a pan, radiographs include. So let's do that outside-in approach. Normal TMJ, sinus is clear, maxilla pathology, no pathology, mandible, no pathology. I've done these over, but the images start blending together, and then I see images in clinic. So I really do look at this the same way each time evaluating. I don't have these answers memorized. Okay, cool. So looks like no pathology. And now let's look at the succedaneous teeth, if any. Great, we have 6 and 11. Oh, I forgot to mention the other one. Look for impactions as well, right? There's no impactions on the upper now. Lower, maybe horizontal impaction developing, maybe. On 17 and 32, but looks like all the permanents are in. That's okay. All right, so now we've got a whole bunch of decay going on here. So let's see. Normal TMJ, agree. Average dental development, I agree, because it should be almost all permanent or permanence at this age. Congenitally missing teeth, looks like, yeah, there's none. Everything was there. Dental decay on the first molars, absolutely. Potential impaction of 1732, agree. Parl 15 and 18. Now, if you look, remember, so I'm going to review this. Some of you that were in my case seminar with me, as we had everyone different, there's the rule of threes. So 3 years for crown development, 3 years after the crown forms to erupt into occlusion, and then 3 years for the root to finish forming. So at a 12-year-old, these are second permanent molars. These are just erupting into the occlusion, right? So that's why I call them the 12-year molars. Second permanent molars are erupting into occlusion. So if we know that it takes 3 years to erupt in occlusion, there's still going to be another 3 years till roots finish forming, then this is perfectly developmentally normal. These are not parls. These are just needs another 3 years for the roots to finish forming. So it should be A through E. Yep, there you go. Perfect. Take a picture. Awesome. All right. Like I said, I'm going to kind of not fly, but I'm going to go faster through these radiology ones so I can get you guys out in time. 12-year-old recall patient, same thing, right? Should be late mixed dentition or permanent teeth. You ordered a pan, notice some congenitally missing teeth. The congenitally missing teeth are great. Quick, just going to do the outside-in approach. Normal TMJs, I can tell you, sinuses are clear. Maxillary, no pathology. Mandible, these are mental foramen, so nope, nothing going on in the mandible. All right, so now let's look for impactions and succedaneous teeth, right? So 1 is not there, right? Because that same 12-year-old should have thirds starting to begin, just like you saw in the other kid. But 2, 3, looks like 4 is missing, so we know 4 is missing. 5 is there, 6, 7, 8, 9, 10, 11, 12, 13 looks like it should have been there, but there's some closure here. 15, 16, 17's not there. Oh, no, I'm sorry, 16's not there, 17's not there. 18, 19, looks like premolars, canine, incisors, canine, premolars. 30, 31, and 32 is missing. So the answer should be, where is it? There we go. Oh, third molars and then 4 and 13. Great. Okay, so remember we're talking about approximate age. Again, I'm going to do that outside in just to reinforce it. Normal TMJs. Looks like there's something going on here in the right sinus. I'm not sure if that's an artifact but it looks like that's what I'm saying. Look at the outside in. There may be nothing, but it's important to see that we would have missed this because we'd be looking for congenitally missing teeth. So something going on in the right sinus. Not sure what that is. Okay, so maxilla looks okay. Mandible, that's normal. That's the whatever hyoid bone or something. Yeah, mandible looks good. All right, so let's look through the succedaneous / impaction. So we have 1, 2, 3. That's 4. I guess the crown 5. No, 5's coming. Here's 5 here. This is 6, but look at it. It's over the lateral root. So that's an impacted 6. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. I'm sorry, this is the approximate age, 19 all the way through 32. So there's nothing missing down there. Okay, good. Approximate age, right? So we know it's primary teeth are, it's not just primary teeth, so it's over six, six or over. We have incisors, we have first permanent molars in, great. The kid's at least eight. And now we're starting to see, if you look at the bottom, premolars and canines are in. Remember, mandibular teeth come in before maxillary. Starting to see the upper molar starting to exfoliate. So this kid's probably about 11 years old. So if you said anywhere between 10 and 12 late mixed dentition, that would be the right answer. Okay. Now this is some of that stuff that's like basic foundational radiographic stuff. So 2 bite wing radiographs for your 6-year-old patient. Bite wings can be taken too. And these are all indicate, I'm just going to tell you the answers, all of them. Detect incipient interprocessing, absolutely. Remember I said take that outside in approach. You're not going to, even if you do miss it, you're going to know to look for caries. But you can also use it to look at the pulp chambers, the depths of the caries lesions also makes sense. You can use it to record the widths of spaces when you've lost primary teeth. That would be an adjunct to your clinical exam. And then the relation of the occlusal plane. So sometimes primary teeth the kids are growing all the time. The occlusal plane should continue to accommodate and modify to match a kid's growth. So when you have a primary tooth that isn't going with the rest of the primary teeth, there's the possibility of ankylosis. So all reasons, as I said, take that outside in approach. All right, so same thing, not getting cases. I'm just going to give you the answer because the quality is horrendous on this one. 5-year-old new patient, you ordered 2 bite wings. This one, diagnostic enough. Caries teeth in the bite wings. So it's really hard to see, especially because you guys will be doing a remote QM proctorial exam. But there's interproximal decay between all the primary molars. B, it's incipient. If you look at the distal B, it's incipient. That's why you may not see that there, but the answer is ABSD. All right, this is the memorization stuff. So gonna take a maxillary occlusal film, right? Maxillary occlusal, 5-year-old, 60 degrees. Just remember, again, one of those memorize and regurgitate right before the competency. Cool. All right. So this ties in a little bit of the caries risk and periodicity, but you need to know periodicity for radiographs. So look at that chart. 6-year-old boy, 6-month recall. Previous appointment, they had bite wings, right? So 6 months ago, had bite wings. No dental caries, and you actually had this kid at low caries risk. So if you remember periodicity, for radiographs for bite wings, I think it's teenagers is different. I'm pretty sure it's either 18 or 24 months, but it's definitely not 6 months. So what would be your choice of radiographs at this time? So none of the above, right? Because low caries risk, no need to take films. Just literally memorize and regurgitate the periodicity chart for radiographs. All right, picture, awesome. Look at this. 5-year-old emergency XCP gets checked out of prep dispense. You have a horizontal here, so you know that it's already going to be something in the posterior area. So this is either going to be a bite wing or a periapical, not an anterior. And in this case, see, it's a periapical, right? Good. So where this is positioned. All right, another one. Here's that vertical one. So now we definitely know it's going to be in the anterior and not in the posterior. So you can already eliminate bite wing, you can eliminate upper posterior, lower posterior. So the answer is going to be C. This is one for the upper incisors. I hope it's not picking up on the mic. I'm in my office, but it sounds like somebody's car alarm's been going off for the last 5 minutes. All right. Pan of your 8-year-old patient, summarize findings. Now, I'm going to tell you, because everyone's like, oh, there must be something wrong. This is a completely normal kid, healthy kid. But let's do the outside-in approach, and that's how you summarize. You can summarize normal findings. TMJ within normal limits, fantastic. So sinuses, no pathology. Maxilla, no pathology. Mandible, no pathology. Let me see this chat question. Oh, awesome. Nobody can hear the alarm. That's fantastic. Sweet. So, okay, so mandible, no pathology. Now you say, okay, within normal limits, TMJ, within normal limits, maxillomandible sinuses. Beautiful. Now let's look at the subcutaneous teeth. Anything missing or impacted? So we have an 8-year-old, so we're not going to have thirds developing yet. We have 12-year molars, second permanence development, that's normal. 2, 3, 4, 5, 6, none of these are impacted. 7 through 10, possible peg lateral number 10, so that might be a finding. 11 not impacted, 12, 13, 14, 15. And if you look at the bottom, 18 through 31, nothing is missing, nothing impacted. Fantastic. And the last thing would be is that of the erupted teeth, do we have average dental development late or fast? And 8-year-old, we're expecting 8 incisors, which we see. First permanent molars fully erupted. It looks like the primary molars and canines are all in there still. So this is totally average dental development for an 8-year-old. You just summarized your radiographic findings. Okay. All right. Which tooth are congenitally missing? So I'm not going to take that outside-in approach, but if you do the outside-in approach, you will. This is something people miss, right? Look at these things. This kid did not have a traumatic brain injury, or skull surgery bilaterally. It's earrings that were left in the kid's ears. So again, it's one of those things. And trust me, when I've been in a rush, I've missed ridiculously obviously things like this. So if you take that outside in approach, you're going to notice an artifact, and unless there's a history of brain surgery or car accident where they have to repair the skull bilaterally, these are likely earrings. Okay, anyway, so don't miss those things, right? Because if you take that outside, you never will. Okay, cool. So let's focus on congenitally missing teeth. So again, I'm just going to tell you based off the teeth that are erupted, it's likely an 8-year-old. So unlikely to have thirds forming at this time. Anyway, 2, 3, 4, 5, 6 with impaction. 7, look, 7 is missing. We still got a primary tooth there. We have 8, 9, 10, 11 not impacted. 12, 13, 14, 15. Oh, and I guess this kid is developing number 16 over there. That's really early. Interesting. Okay. See, that's what I mean. And look, just starting here, something here. So maybe this kid is going to have the thirds developing soon, but just at the very, very beginning. 17, 18, 19, 20 is definitely missing there, right? So this is where you're going to look at bite wings and say, hey, make sure this number K is still growing with the occlusion. Otherwise, we have an ankylosis situation. 21, 22 incisors, 27, 28, 29 is missing, right? 30 and 31. So it looks like the culprits here are 20 and 29. And if you remember, mandibular second premolars, most common to be missing, followed by maxillary laterals. Followed by maxillary all after the third molars are the most common. I'm sorry. Third molars are the most common to missing, followed by second mandibular premolars and maxillary laterals. Awesome. All right. This is not a great question, but this is just looking at bite wings. So where are the permanent teeth? We have 3, 14, 19, and 30. You can see 18 and 31 starting to develop, maybe number 2 and 15. I don't like this question because it's like, it doesn't say which, we can see the developing permanent teeth. That's great. It doesn't say developing or erupted. You're not going to get a question like that, but it's just practice to say that even though, and this is happening in clinic when we're in a rush, students think that the second primary molar is actually the first permanent molar. But if you think about dental ages and everything and sizes, anatomically, it's exactly the same as a first permanent molar. It's just smaller. So it's not it's relative, but I've had students mix those up in clinics. So, because they look anatomically the same. And I actually, on Monday, I extracted a number K on a kid. And I had to double check that I extracted the right tooth because it was huge and it looked like I took out the first permanent molar. But in fact, I made sure it wasn't. But just to know that where the permanents are. So the same question in this is that, okay, same thing, right? Is this A or is this number 1, A number 3? But this is a primary molar versus a permanent molar. Anatomically the same, but smaller. This is definitely premolar shape. Looks like you have all your other premolars, right? 28, 29. Again, all permanent teeth on the left bite wing as well. So the primary tooth in this one is number A. All right, pathology. Let's do the outside in approach. TMJ is normal. Unlikely to see anything weird with TMJs unless a traumatic accident, like I said. Sinus is clear, no wacko brain surgery screws or earrings. Maxillary, no pathology. Let's go there we go. Look at the mandible. Look at the lower left quadrant. It's like an odontoma down there, and it's impacting the number 22. So this is definitely pathology here. Okay, cool. And then let me just check. The other part of the mandible looks good. Nothing at the teeth. Okay, good. All right, dental radiograph. This is an occlusal. It's not a PA. It's an occlusal. We take occlusals on kids where it's a horizontal as opposed to a vertical orientation because the mouths are small and we want to get this. So this is a mandibular occlusal. Okay. Identify the tooth associated pathology. So let's go outside in, right? So looks like this is bone trabeculation looks okay. No PAPs. We got what is it, 7, 8, 9, 10, 11's up here. This is 12. This is I. This is H. And then look, yeah, right there. You see that over number 9? Looks like there's a horizontal root fracture in number 9 towards the cervical area, not the apical area. All right, fantastic, everyone. Again, I really want this to be review for the day before or whatever it is to basically if you're pass it if you're solid in your B or your A or whatever, but if you are borderline C to B or B to A, do your best. It's your last one that's going to count, and historically this has been the grade booster competency, and I was able to get the competency earlier. They'll both be the same morning, so take one then take the other. Hopefully it's a short morning. But yeah, review the questions, review the guidelines, and of course, anytime before, I think it's March 4 or 11, you guys take it, drop me an email, okay? I hope to see some of you in clinic. We're still trying to get you guys through block, and let me know. Thanks, everyone.